the actual definition of stroke. I'm going to focus on stroke. It is sudden death of brain cells in a localized area due to the lack of oxygen, which is caused by a blockage of blood flow or rupture of an artery to the brain. So there's really two main types of stroke. One can come from a clot, so you're not feeding oxygen to that area of the brain and the cells die. You can think of a big Charlie horse in your leg when you're working out and you're not getting oxygen there. This is similar, but in your brain, and when cells don't get oxygen, they become necrotic. They die. It can also happen if there's a hemorrhage, as I was referring to with Charlotte, where there's an aneurysm or a bleed, somebody hitting their head. Those subarachnoid hemorrhages you hear about when people are skiing, snowboarding. There's a difference between stroke and transient ischemic attack. Has anybody heard of a TIA before? TIAs are common as well. A TIA is similar to a stroke, but there are no residual symptoms afterwards. So to be classified as a stroke, somebody must have had the first definition occur, where they have a blockage of flow, but then it doesn't resolve itself. You have prolonged symptoms. So some of those are paralysis, weakness, slurred speech, personality changes, because it affects different parts of the brain. Frontal lobe will see a lot of personality changes. It's also called a CVA, known as cerebrovascular incident. So this was just an image to show you basically the brain and how if there's damage on the left side of the brain, you'll see symptoms on the right side of the body and vice versa, okay? So risk factors, there's two types of risk factors. Ones are controllable, things you can do something about. And then there's ones that you cannot do anything about. Controllable risk factors include high blood pressure, high cholesterol, diabetes, being overweight, excessive alcohol consumption, physical inactivity, smoking, and stress. So you can see that all of those really do relate to lifestyle. So choices that we make